Welcome to the Cervical Cancer Survivor Series. I'm Martha Kempner with the American Sexual Health Association and the National Cervical Cancer Coalition. We recently reached out to survivors across the country to hear their stories of diagnosis, treatment, and survivorship, and get their advice for others whose lives are impacted by this preventable disease. We also talked to providers in the field to answer questions about screening, prevention, and treatment. In this episode, we speak to Shaundra Hall. Shaundra tells us that her very first Pap test came back abnormal, but she still didn't know anything about cervical cancer when she was diagnosed. She also talks about how this experience changed the course of her life, both personally and professionally. Thank you for joining us. Can you introduce yourself and tell us who you are and what you do in your regular life, and then also your connection to the National Cervical Cancer Coalition?
You bet. So I'm Shaundra Hall. I am, for my career, I'm in clinical research regulatory affairs, and I am Southwest chapter leader for the National Cervical Cancer Coalition.
You're also a cervical cancer survivor. Can you tell me, when did you find out and how did you find out that you had cervical cancer?
Back in my mid-20s, got married, moved to Arizona, and after a couple of years trying to establish ourselves here in this new state with no family, no friends here, we decided that after about 4 years, we would start trying for a family. About a year went by and we still weren't pregnant. And so went back to my physician and said, look, we've been trying for a year. What's the next step here? And he said, well, we're going to do an exam. And when your doctor does an exam and says, oh no, that's really never a good thing.
Actually said, oh no.
Mm-hmm.
Oh no, that's not good at all.
He either said, oh no, or oh dear. But, it was something that was very concerning. And I had been a chronic HPV sufferer on and off for years. I had had a lot of work done on my cervix. I had had cold cones. I'd had the cryo freezing. I'd had leaps. I'd had over a span of 10 years. And so I knew what my history was. I was very active in my health and my gynecologic health. And so I knew that it was something probably related to that, but I certainly didn't think it was cancer.
Can we go back for a minute and just tell me, when did you first find out about the HPV and how did you find out about that?
So I'd had abnormal PAPs. My very first PAP was abnormal. And so on and off, I had a great physician. He taught me all about being vigilant about my future PAP exams. And so I was vigilant about that. And some years I would have an abnormal PAP, and some years it would be normal. But I was just always vigilant. I always kept up with that. I did not know that HPV was involved with my cervical health and the issues I was having until after I'd had cervical cancer. After I had been diagnosed with cervical cancer, only then did I learn about HPV, what it was, what it causes, all the various strains that can cause all sorts of nefarious activities in males and females. And so really, I didn't even know what HPV was until after I had cancer.
You had abnormal pap smears. Your doctor treated abnormal pap smears, but they never told you about HPV.
No, it was just, some girls get abnormal paps and some didn't. And you have to remember, like, my first pap was in 1987. I mean, this is back in the day. HPV, and even talking about it, really wasn't on the scene back then. It was really not until probably the late 90s, early 2000s that even the term HPV, or human papillomavirus, was really mainstream. Of course, it was talked about in healthcare circles, but as far as the general public goes, it just really wasn't talked about, at least not to me and not to any of my friends, because, girls talk to other girls. especially when they're having issues. And none of my girlfriends had ever brought up HPV to me or knew what it was.
Also, obviously, the HPV vaccine hadn't come on the market yet, so we didn't talk about that.
Correct.
Do you want to give our listeners a little bit about what are these procedures that you had after your abnormal pap smears? And were you ever asked to decide which one?
Originally, it was conservative. I was young. And so what they did was they did what was called my initial one, it was called a cold cone. And so really they would go in and take a little cone shape sample out of my cervix because not only did they want to get the surface cells, but they wanted to go a little deep because they wanted to see if the invasion of the abnormal cells was deep as well. Then there was a procedure called a LEEP, LEEP, and that was electrical excision essentially. And so that's a little wand, has a little electromagnetic current that goes through it, electric current that goes through it, and then they kind of carve it out. But what happens when you do that is that it essentially cauterizes and burns the area at the same time. So it's really hard to tell if there's any suspect tissue left over. And then the cryo or the freezing procedure was all over the place. And everybody was doing cryo where they would go in and they would freeze the cells in question. And so they would go in, they do this procedure where it literally freezes the cells on your cervix. And that wasn't so fun either because up to a day or two, you're having this watery discharge because after it starts thawing out, essentially, it was really messy. So then, fast forward after a decade, I'd had 4 years of clean paps, trying to get pregnant, can't get pregnant, go back in, and then I've got this nasty old tumor on my cervix. And so they tried to, under general anesthesia, because after they looked at it, it was so deep and so far in, they didn't want to do it outpatient. They literally wanted to do it under general anesthesia. And so I was under general anesthesia. They took out the area affected, which was fairly substantial. And then the pathology came back. They did not get what we call clean margins, which essentially meant that there were still some affected cells left in my cervix in the area. And so when they sent it to the pathology, it was invasive cancer. And so that's when they called me and said I needed to get in for surgery and I was going to have a hysterectomy at the age of 28 years old.
Wow. That's a lot to deal with to find out both that you have cancer and that you're going to need a hysterectomy. I don't really want to get you back to those days, but tell me, what were you thinking? What resources did you have at your disposal at that time, if any?
When I had received my diagnosis, I was, 28. I would thought, oh my gosh, not only do I have cancer, but I'm not going to get to have my husband's children. And so it was like a double whammy. I had never had that I have to be a mother feeling. So I was okay with not having kids. I'd rather live than have kids and then not be around to raise them. So I felt disheartened for my husband. And then I really felt my second thought was my parents, my dad. So my dad, I'm the only biological child from my father. He did not have any sons. He did not have any brothers. So I was the end of a lineage that went back to the 1600s. So that was a heavy burden on my shoulders as well. As odd as that sounds, that's what I thought of. Like, oh my gosh, there's not. I mean, I'm not going to have any. Not only am I not going to have sons, I'm not going to have daughters either. So biologic on my father's side. So I carried that with me for quite a while, and it was probably 10 years later I finally confessed that to my father because it just weighed on me so heavily. I said, "Oh, honey." I never gave that a single thought.
I mean, he just wants you to be okay as well.
Yeah.
So, was there any follow-up treatment needed after the hysterectomy?
When I had a total radical abdominal hysterectomy, but because when they took everything out, and by that I mean uterus, upper third of the vagina, cervix, of course, they left my fallopian tubes and my ovaries. And what they did is they relocated them because it wasn't so extensive that they thought they were going to have to remove everything, especially because I was so young. They wanted me to go through menopause naturally as I age. So I was supposed to have chemo and radiation. I was supposed to have the full smash according to NCCN guidelines. However, I had a very conservative doctor, and he said the residual cancer that was left was just about the size of a pinky nail. And they knew that they got all of that out. And he really felt that chemo, radiation, especially intravaginal radiation, was going to do more harm than good. He said without that, he still felt I had a 98% survival rate at the 5 year mark. And so we discussed it as a team, discussed it with my husband. I looked everything up. I did have some apprehension about not having chemo and not having radiation because your first thought is throw everything but the kitchen sink at it to make sure that you have done everything you can to survive. But after weighing my options, that was the decision we wound up going with. So I am so thankful that I had a very thoughtful physician that explained everything to me very, very well, and that we made a decision as a team.
Yeah, I don't think everyone has that experience.
No.
What is follow-up like? Because you did tell me earlier that that can be one of the more stressful things. You have the surgery, you know you're cancer-free, but then you have to wait and see if it comes back.
Indeed. So follow up was PAP exams every 3 months for 2 years and scans. And so it's like you get something that we refer to as scanxiety because you're just living from scan to scan or from test to test. You just always hold your breath for a long time. I won't necessarily call it PTSD, but I had a reaction to the smell of asphalt because my provider, when I would go for my follow ups, they had just tarred their parking lot and it smelled of asphalt. And especially being in Phoenix, asphalt, you can smell, especially when it heats up in the summers, that when I would go for a long time, that the smell of asphalt would trigger that anxiety.
Wow, that's really interesting.
There's a saying that goes in the survivor community, especially for those that have had chemo, never eat your favorite foods or smell your favorite smells, because once you're post treatment and trying to move on with your life, those things will trigger you and take you right back to where you were. And so, fast forward, got a job with a construction company, and then I was smelling asphalt all the time. So I was able to kind of get over that. But getting back to the treatment, so yeah, for 2 years it was exams, scans, blood tests, labs for every 3 months, pap smears every 3 months. And then after that, everything came back great. So then I graduated to once a year. And then after that, every 2 years. And then the guidelines changed and said if you have negative HPV testing and you don't have an abnormal pap, you can go every 3 years. So now I'm at the every 3 years. And I don't have a cervix, so they don't do a pap for the cervix, but it's still super important, even years out from your diagnosis and treatment. Still get your annual exams from your gynecologist or your provider, because it is really important to have somebody do that visual inspection and still make sure that all of the tissues around are doing as well as they can be, and that there's no new growth, there's no, especially if you've had HPV, it can cause other issues, other cancers. So keep going.
So I want to go back to scanxiety, which is a great word, and I can imagine incredibly stressful. What advice would you give to someone else who's, reached that point where they're post-treatment but need to be checked regularly? Are there any coping skills you wish you had at the time?
So for a good part of that, his nurse, my gynecologic oncologist nurse, she was pregnant. So hearing post-cancer, hysterectomy or post-hysterectomy, going through post-surgery, going through all my follow-ups, and the lady that greets me every 3 months for 3 times is pregnant. And I was just like, this is so surreal. And I wish I had taken a book. I wish I had taken something of comfort. I would just go and just sit. And that was before cell phones and smartphones. So now we can kind of get lost in reading something or playing a game or listening to music. I did not have that. I wish I'd just taken crossword puzzle. And not even being on that screen time, that's not necessarily great for us all the time either. So take a book, take a crossword puzzle, take a find a word, search word, just something to get your brain and your mind off while you're sitting there in the waiting room, because otherwise you're just going to sit there and keep getting ramped up and ramped up and ramped up about, not only the exam and the visit itself, but then you got to go and you have to wait for all the results.
Same thing, I would assume, for the few days or the week in between getting the test and getting the results.
Yes, absolutely. I did puzzles. I did a lot of breathing exercises. I did a lot of meditation. I did a lot of visualization. I would, at night when I would go to sleep, I would breathe in the healthy air and I would expel the bad cells and the bad air. And I would visualize my body creating healthy cells that were going to fight and they were going to be my cell warriors against any bad cells that lived in my body and push all those bad cells out. So I took a lot of advice. I listened to a lot of recommendations. So I did everything that I could to get from day to day and sometimes hour to hour.
At some point, do you feel like I mean, you say now you're only going for scans every 3 years and you've been cancer free for a very long time. Do you feel in a way like you've gotten past it, or has it really just become part of who you are at this?
I will say I have gotten past it. And I will tell you, the day I realized that was when one of my closest, dearest friends texted me and said, Happy Cancer Anniversary. And I didn't even realize that was my cancer anniversary date. And I had made a conscious effort with my husband and with my family that I didn't want to live around that date, because then I was back in a cycle of living from that date to the same date next year to the same date. And I said, I just want to live my life the way I want to live it every day. At 25, let's just let that be the last marker, the last anniversary. And so this year in April is when I celebrated my 25th cancer anniversary. I'm just like, okay, that's cool. And then, my husband and I went out to dinner and that was it. Because the first year I had a party, year 5 I had a party, year 10 I had a party. And then I was like, I'm ready. I'm going to focus my energy elsewhere, supporting, advocating, helping patients learn about clinical trial options. And so that's now what my focus is, like moving forward, helping others instead of looking back and trying. And because I still feel like I'm looking over my shoulder when I celebrate those dates. So now I just focus on other things in the future and the forward.
I want to talk about all your advocacy work, but before we get there, if you're comfortable talking about this, we are the American Sexual Health Association, in addition to the National Cervical Cancer Coalition. And sometimes when we talk about cervical cancer in particular, and HPV in particular, because it is a sexually transmitted disease, there is a layer of stigma that comes with this diagnosis that doesn't come with some other cancer diagnoses. And I want to first ask if you feel like you've experienced that at any point, and then ask for your advice for anyone who does feel like they're experiencing it.
Well, I'm happy to say, because the general term of HPV is in our daily lexicon, it seems anymore with the general public. There's not the stigma that used to be. Back in the day, there certainly was, oh, it's a sexually transmitted disease or a sexual infection. One of my colleagues with the Arizona chapter of the National Cervical Cancer Coalition, when she disclosed that she had had cervical cancer to a colleague, they said, well, that's the whore cancer, isn't it?
Wow.
So, of course, she was taken aback. That, I believe, happened to her a good 10 years ago. I have never experienced it. If anybody's had any judgment, they've kept it to themselves, and probably rightfully so, because I think they know if they were to bring that up to me, and we would have a very direct and very abrupt conversation and educational session about it. And it's with the education generally, we now have done very well explaining to the general public that 80% of all men and women are going to be infected with some strain of HPV in their lifetimes. Many will never know it, some will, and some will have adverse effects like I did, resulting in either genital warts, cervical cancer, penile cancer, vulvar cancer, and any anogenital cancers, and we now know it also causes head and neck cancer. So it's ubiquitous. HPV infection is ubiquitous globally. And now that they're testing, they're co-testing, so you're not just getting a pap exam. Most providers are doing pap and HPV testing, and then you're getting your results of the HPV test along with the serotypes. I mean, that's amazing. And we have a 9-valent vaccine for it. I mean, we've come leaps and bounds today where we were when I went through my journey, which makes me feel great. And I would say the education and the awareness now that almost everybody globally is going to get some version or some strain of a HPV infection, I think has really done a monumental job in destigmatizing HPV and really making people more accepting of this is just yet another viral infection that is going throughout our human populace. Because a lot of people that were judging probably never thought they were ever going to get HPV, and then they get their test results back and surprise. So yeah, I don't think we have that stigma as much as we used to.
So you talk about educating, and you've definitely been involved with that now. What are some of the things that you've done as an advocate that you're really proud of and that you think kind of has contributed to this?
I have a lot of opportunities to share my story, talk about cervix cancer, talk about HPV in many different settings. And one of my favorite things is talking to clinicians and providers. I can't speak to them at their level. I'm not a clinician, I'm not medically trained, I'm not a physician, I'm not an MP. But when I talk to them about my journey and about the journeys of all the other ladies that have shared their stories with me, and have a clinician come back to me and say, you have changed how I treat my patients, that is my biggest point of pride because they haven't been through it. I did a speaking engagement on a local Native American reservation to their clinic staff. And one of the clinic staff came to me and said, I practice medicine and I never knew that cervical cancer was caused by HPV. My mom died of cervical cancer, and all the women in our family on the reservation thought we were going to die of cervical because we thought it was hereditary.
Wow.
So it's pretty shocking when you have somebody who is medically trained and still doesn't know because there's so much to know in healthcare, and you can't assume just because they are trained professionally that they know everything about everything. I had another conversation with one of the leading gynecologic oncologists in the world, and we had this anxiety conversation because he was designing a clinical trial and asked me to be the patient advocate on the trial. They were talking about scan span. And I said, look, you're the professional, you're the physician, you know what's best, but I'm going to tell you, please don't overscan because we live from scan to scan. We live from test to test. And if you can still get the right amount of data that you need, that's relevant and that is going to be productive for the trial, try and do that in a longer span of time. And so we talked through why, and he was one of the ones that said to me, I had forever changed how he's going to design his trials and how he's going to treat his patients because he was thinking more was more. more frequent, that the better it would be, because they could catch it sooner and, be able to action it. But then he did a retrospective and he really didn't feel that there was any bigger of a difference to do it more frequently than in a, marginally longer span between time. So that's where I'm like, okay, this is Wes.
Clinical trials, which is now what you do professionally. Tell me how you got into that field. I'm assuming these two things are related, and also what message you want to give to other people going through cervical cancer treatment about clinical trials.
I was in administration by a profession, and I wound up working for a boutique cancer hospital, and just as an administrative assistant. But by being in that environment and learning even more about healthcare, and then getting my toe in the water with exposure to clinical trials, just on a completely administrative level, it really grabbed my attention. So fast forward, I wound up getting a position with another national healthcare organization for specifically for their clinical trial program. And that's when I really got immersed. And so I learned more about regulatory affairs, and that really piqued my interest, because then I could parlay my skills and experience with being an executive assistant and being an administrative supervision into exactly that, but specific to that industry of healthcare. So I learned, marrying my personal life with my professional life, I realized there's really not a lot of chatter in the support communities about clinical trials and clinical research options. Most people, and this is what I was shocked to find out, most people think that a clinical trial is only for a Hail Mary. Like, if they have no other options, that's when I'm going to seek out a clinical trial. Whereas there are so many different types. There's observational trials, there's stage 1 trials, there's 2, stage 2, and there's for all different kinds of health conditions. And when I started realizing that, especially in gynecologic oncology, unless you get connected with the provider who is really vested already in clinical research, chances are you're not going to get recommended for a trial, no matter what your diagnosis is and no matter what your stage is, if it is an oncology trial. And not all practicing NPs, PAs, physicians, MDs, DOs, they don't necessarily engage in research. So if your provider isn't engaged in research, they're most likely never going to recommend a clinical trial for you. So my role now as an advocate is try and get the word out there. There are all these wonderful clinical trials that are available all over the country. And to encourage the medical community, please stay up to date. And if you have a candidate who's looking for standard of care plus, because a lot of people, there's also a misnomer that if you're going to enroll in a trial, you're going to be withheld standard of care, and that's not how it works. You get standard of care plus. Look it up and find out where your patient could be a good participant in a trial, because we're trying to make healthcare better. We're trying to change standard of healthcare. We're trying to make standard of healthcare less toxic, less burdensome, less financial cost to the participants and to future patients. There are very few people that I know who have undergone any significant illness or injury that haven't wanted to pay it forward and make it better for the next generation. Perfect way to do that is to enroll in a clinical trial.
So what you're suggesting is that, we all think of it as testing a new treatment plan, and either you're getting that new treatment plan or you're getting a placebo. But you're telling us that in reality, there's a lot of other kinds of clinical trials out there.
I mean, there's all sorts of combinations of things that these really smart, dedicated humans want to do to better humanity. And how amazing is it for those who can help them with their increase of knowledge and education and paving the way for people so that maybe we do change standard of care. It's not just for the sake of science, but you can also get the opportunity to participate in a study and receive something that is going to improve your quality of life or prolong the quantity of your life.
My last question for you is, what made you want to become an advocate and work with the National Cervical Cancer Coalition?
Back in the late 90s, internet was not in every home. Not everybody had a computer or access to a computer. Even my own employer, I think we had part-time internet connection because you used to pay by the hour, believe it or not. And so I did get online because I wanted to learn, what is squamous cell carcinoma? What does stage 1B mean? What does this mean? I got my report and I wanted to look up every word I did not know or understand. And there wasn't a lot out there. There were no support organizations. Susan G. Komen, everything was pink washed at the time. They were so hot and they were everywhere. Komen. If you didn't have breast cancer, if you were in with the in crowd, you were out, especially with a gynecologic cancer. So I found all this great literature through Komen, American Cancer Society on breast cancer. And then after like day 2 or 3, I found the National Cervical Cancer Coalition. It was in its infancy. I don't think the NCCC had been around for very long at all. Somehow, I think it was through their newsletter, paper newsletter, not email, because I didn't even have an email address then. I got a paper newsletter and it said there was going to be a conference. And I said, I've got to go to this conference. I went to my boss and I said, I need to go to this conference. I can't afford to go. Can I please ask for a advance on my salary so I can buy my plane ticket and attend this conference? Because of the generosity of one man who said yes, when he easily could have said no, sent me on a 25-year journey. And I've traveled all over the country. I have met with Nobel Prize winners. I've been able to speak to amazing men and women, change a few lives, even if only in a small way. And I'll be forever grateful to him. He passed away not too long ago, but God is good, and that I was able to publicly thank him. So he knew what his impact on my life has meant to me and meant to so many other people globally, literally. It's pretty incredible when you think that saying yes to one person instead of saying no can have that ripple effect and affect essentially probably by now thousands and thousands of people. So I thanked him, and I'm glad before he passed away, I was able to publicly name him and acknowledge him and give him the grace and the gratitude that he deserves before he dies, and so that his family, because he had no idea. He had no idea.
He made such a difference.
Yeah.
Shaundra, did you have anything else you wanted to say that you felt you didn't get to?
I would say, could you add the website for www.clinicaltrials.gov? That's the NIH's website. It's the only database that has all clinical trials going on for everything under the sun for federal, any sort of trial that's federally funded by law has to be listed on that website. So if you could put that in there somewhere, that would be super.
That's a great idea.
Thanks so much for all of this.
Thank you so much for listening. If you want to listen to all episodes in our Cervical Cancer Survivor series, head to nccc-online.org, where you can also find a lot of information about cervical cancer prevention and screening.